David Warwick of Warwick Chiropractic here in Lacey, Washington, and I'm going to be helping one of the martial artists here. We'll use first name only, and that's Jay for John here. He gets some low back pain and does some traveling, so most commonly neuritis or sciatica type pain that patients will get. There's other types of nerve related pain, but when you get a misalignment in the spine, that affects how your body moves. And one of the things that happens throughout the day is that the body positions can be sitting at a desk, driving even, can affect how you feel. So I'm going to go through an evaluation in chiropractic, get him a little situated here. Look at some of the things that we look at first is posture. Obviously he's been sitting today. I can see a higher hip here, higher shoulder right here. Chiropractors start out their treatments and evaluations in many different ways, but one of the things I look for is how the body's laying in in a neutral position. I look at different areas that will stress the spine. So first of all, he has a heel that's a little bit higher than the other one, so that indicates there's more stress front and back on the spinal cord and involvement with the pelvis here. And some of this you're not going to pick up just on the camera, but I'm able to communicate it to him based on what I'm seeing here. And sure enough, it's the right, what we call the SI joint. It's more the pelvis than it is his sacrum so far at that point. That joint feels locked in that position. As soon as I move that in a forward type motion here, that restored more of his movement. That's going to start taking some of that pressure off that nerve area. So we're working with the pelvis to start with. He's a fairly active person. Obviously been doing martial arts for a long time. How many years now?
About 6.
Yeah.
Or more.
Yep. Good job. Okay, so right leg is even. Now I'm starting to feel tension and pressure into the lower back, in his quads as I start bending the legs up in here. So that tells me there's some pinching on the nerves in the upper portion of the lower back. But we're going to start looking at some other aspects that may be contributing to it as well. Sometimes the pelvis can go front and back, in and out, or a combination of all those kind of movements. And some chiropractors find that on the films they take, as well as what we see on the table that's changing here. So I'm going to adjust the left pelvis here. Got a little bit better. Okay, go ahead, John, raise that leg for me. Don't bend the knee. Don't bend the knee. Oops. Yep. And down. Other one. Back down. So they're about the same distance. We're checking the sacrum. I'd like to see a lot more movement in his legs like this. They should be able to raise straight up. So first of all, we're going to pressure test that joint. That made the leg approximately an inch short on the right side. As soon as I did that, you can see when I move it in position 2 and 3, it went a little longer. So that bone, the triangle bone, is sitting back this way. So we're going to help bring that down. The technique we're using is called drop pelvic or Thompson technique. Go ahead, raise this leg. Back down. Other one. Back down. Still a little bit slow on this side, not as high, so we're going to continue and move throughout the lumbar spine. Those are the nerves in the lower back that talk to the muscles in the leg. Go ahead, put your right hand on the lower back for me. Okay, so his leg drew up shorter on that movement, so we're isolating L5. Hand down for me, John. Good. And I'm going to use the instrument called the activator. Switch hands for me. Let's have you go. That's testing L4. And back down. Adjusting L4, right side as well. Raise your right hip toward the ceiling. Back down. We're checking L3, so nothing in that position, 2 or 3. And both hands on your lower back for me. Okay, we're testing L2. Right leg went about 1.25 inches short, 1.5 inches. So he has a lot of stress coming from the lumbar spine as well as the upper lumbar spine. Hands down for me. Good. Right hand lower back, left hand above your head. Back down. Okay, lay on your left side. I'm going to see if I could get a little bit more movement in his lower back, get that pressure of the nerve, or pressure off the nerve so he can function and move easier. I mean, that's what he came in for. So a little bit of movement at L2 right here. Good. Go face down. See if we can get a little bit more movement. So I'm adjusting right at L2. Not too hard on him, just enough to get that pressure off the nerve. Good. And what we're going to do next is do a traction into the lower back right here. Traction, if your chiropractors do any kind of traction, that helps hydrate the disc, create motion and movement in the joint. Just one of the many styles or techniques that chiropractors can use in their practice. You okay?
Mm-hmm.
Yeah, we're going to actually come up a little bit more here. Because of the training your chiropractors have, we can feel a lot of the areas of motion or lack of movement under our fingers and hands. So kind of hard for a camera to pick that up or a video to pick that up. That's something that a chiropractor develops over time. They can feel the spasm, the lack of motion into a joint, movement. Ultimately, we want to get the patient out of pain as quickly as possible and get them back functioning in their lives. Even chiropractors get hung up a little bit. I guess you got to have a sense of humor. So what I'm trying to do right here as I move the machine in, I'm trying to loosen up the muscle called the paraspinals of the lumbar or quadratus lumborum right there. One of the big low back contributors to pain. But the biggest thing that we'll see when people have low back problems, they do too much sitting, guess what it is? It's the hamstrings. Over 90% of the time, that's what we'll see is that hamstrings are way too tight. So on some of the videos, you'll notice me working through the hamstrings, the piriformis, and the glutes right here. But if people stretch a little more, they drive or sit throughout the day, stretch your hamstrings a bit to make them longer. That's going to reduce a lot of the low back pain. Our bodies are not used to that much sitting. We didn't have back pain as much when we were kids because guess what? We were outside playing. Today, we sit behind a desk, we drive a lot. As we get to adult, and we don't get enough exercise in our body. Okay?
Yeah.
Okay.
What you want me to do?
No, just relax.
And what's a good exercise to stretch your hamstring?
Oh, there's so many of them, but the thing that you can do is, if you can't lay on your back, just simple bending over and stretching to touch your toes.
Oh yeah, I do that.
But you can even do a leg crossover. A lot of runners do that, one leg in front of the other.
I do that.
The way to reduce injury to your lower back, is to make sure you drop some of that weight into your knees as you come up. And we're going to bring this down.
I've been doing a
lot of the crossovers.
I actually got a book on stretching. I've been trying to do the lower back stretches.
There's so many great books out there. Bob Anderson has some really good ones on there, and you can get stuff online now. Raise this leg without bending the knee for me. Back down, try the other one. Back down, go ahead, lay on your back. So I'm going to show you one of the stretches that we do, that I actually do with patients. In
I
fact,
got one of those
say
the
again?
rollers that you recommend.
Yep, the high density foam roller. I have a video of it. You can watch on that on YouTube. Okay, push your heel into my hand. Hold, hold, hold. Keep pushing. Slowly relax for me. Yeah, see, real tight here. We like to see at least 90 degrees. He's coming up at about 70, and then his knee starts to buckle, so all these hamstrings are real tight in there, and that's just something he's got to work on his own. So this one came up easier.
My
But
left's always more
yeah, yeah. And I still feel it, but it was a lot looser on the whole range of motion or the motion upward. Push your heel into my hand and relax. Like to keep your shoe on, huh? All right, I'm Dr. David Warwick at Warwick Chiropractic. Thank you for watching. I appreciate it.